Hello, and welcome to the St. Mark's Episcopal Day School Open Enrollment webinar. Your open enrollment is from February 11th through February 22nd. During this open enrollment period, you can make elections for our next plan year, beginning on April 1st, 2019 and running through March 31st, 2020. This year, we're excited to welcome 27 member institutions to our 17th annual ICUBA Open Enrollment. So we hope you enjoy this information and it adds a lot of value. ICUBA tackles the biggest challenges when it comes to your healthcare benefits. We make sure that we partner with the right insurance carriers to provide the right access so you can seek care at the right place with the right provider at the right time. We encourage our members to stay engaged in the programs that we offer, like Rally, to improve your health and well-being. We make sure that our members have access to the highest quality care that is also safe and effective for the lowest cost possible through our partnerships. This ultimately, we hope, will improve your outcomes and the health and well-being of all ICUBA members.
Did you know the ICUBA medical plans are self-funded? And as a self-funded medical plan, ICUBA pays all claims processed by our medical, pharmacy, and behavioral health partners from premiums collected and reserve built up over the years. ICUBA keeps all premium dollars saved for the exclusive benefit of our members. ICUBA spends premium dollars only on benefits for our members, and ICUBA's plans are specifically designed by educators for educators. And we invest in a long-term culture of well-being so you can be the best version of yourself. And so we mentioned earlier some of those challenges, so we've established programs and efficiencies to help mitigate claims. We've done this by breaking down barriers to care and adapting the plans to provide quality and value. Some of the things we've done is the $0 co-payments for our Blue Distinction Total Care providers, $5 teledoc visits, low prescription drug co-payment structures. We always encourage biometric screenings each year so you know your numbers. We provide case management and care consultants, and we also are innovative and willing to invest in resources such as ICUBA Cares, Teledoc, Resources for Living, Rally, and then new this year, Surgery Plus. And so there's a call to action. What you need to know or do to be a smart consumer. You can take advantage of preventative care services so you know your baseline numbers. Register for Teledoc in preparation of a sore throat or sinus infection. Call ICUBA Cares to see if you can help lower your prescription drug costs. Take advantage of those 6 free EAP sessions where you can meet with a counselor and get some advice. Visit your dermatologist for a free skin cancer screening. Use the Blue Cross and Blue Shield pricing tools to help you shop for services such as advanced imaging, and then make sure that you join those Rally City challenges and sync your device for a chance to win a $50 Amazon gift incentive.
So we conducted a member survey late last year, and we realized, and from your feedback, that the ICUBA membership's main concern is the cost of our benefits. Why are the benefits so expensive? So we put together this diagram to show you how ICUBA stacks up against the others. This shows the average annual cost of employee-only coverage across all of our member institutions. So this illustration also takes into account adjustment factors for demographics because our population is slightly older than the norm. The location, because the state of Florida is one of the most expensive states to provide insurance in, and our plan value is much richer than the average plan out in the market. So in seeing this diagram visually, you can see that ICUBA's benefits are in fact cheaper than the education industry in the middle and then all the other plans on the far side. Just to further how ICUBA stacks up against the others, this is another way to look at our benchmarking statistics. On the left side, you'll see all other PPO plans. So these are all the plans on the market, many that don't have as generous of a benefit plan as I do, or as we do in general. And then on the right side, you'll see ICUBA versus the education industry. What this illustration shows is that IQVIA's costs are 17% below the broad database benchmark average on the left, and then 22% below the education average, which is on the right. The average mark is the blue dot in the middle of these lines. So you really are getting more bang for your buck with the IQVIA benefits. So what are some other things that we're going to talk about during this presentation? We're going to cover enrollment and eligibility, some perks that IQVIA offers to you, and our 2019 benefit plans.
First up is enrollment and eligibility, and so we'll begin by how you enroll in your benefits. You'll do this at IQVIAbenefits.org. Right now is open enrollment, so you are free to make changes to your plan for the upcoming plan year. These benefits will remain in effect for the entire plan year unless you have a qualifying life event. And of course, if there is a mid-year event, you have 30 days from the date of that event to log in and make the necessary changes. But for right now, during open enrollment, how do you get started? You'll go to IQVIAbenefits.org, log in, and at the top of the screen, you'll see a button that says Start Your Enrollment. Also available again this year is Ask Emma. She is available in English and Spanish. Emma is a decision support tool, so no more wondering which plan is right for you. You'll simply ask Emma. You'll go through a personalized walkthrough of some questions, and those questions will help Emma help you to make the right choice as far as plans using real life information and annual cost. Emma also has a frequently asked questions section, so if you're confused about maybe what a deductible or out-of-pocket means, she's available to help you with that as well.
So who can be enrolled in the IQVIA plans? These are the eligible dependents that we cover: a legally recognized spouse, natural child, legally adopted child, stepchild, child covered by a qualified medical child support order, a child that you have proof of legal guardianship who also resides with you, or foster children. IQVIA's plan is very unique in which we cover dependents to the end of the year in which they turn 26. So if you have a dependent turning 26 in January, February, or March, they're still eligible to be enrolled in benefits as of April 1st. We will just send you a note towards the end of the year that it's time for them to find their own insurance. We know that all employees read every single bit of fine print before they click the I agree button at the end of your enrollment. But in case you missed this paragraph, in the enrollment, you are agreeing that all dependents enrolled in your medical plan and the other benefits offered are in fact legally your dependents.
We also wanted to highlight our open enrollment sweepstakes. We're holding again a private sweepstakes this year. And when you log into the IQVIA benefits portal for your enrollment, you'll be asked to update or confirm your personal phone number and email address. And by doing that, you'll be entered into our sweepstakes for a chance to win an Amazon gift incentive. So as you're going through your enrollment, make sure you verify that information and click on the I agree button so that we know that your information is correct and up to date. If your mailing address is incorrect, then be sure to contact your Human Resources office so they can update that information for you. We also just wanted to review our single sign-on links that are available to you on the IQVIA benefits portal under the My Carrier Account section. With these links, you'll be able to access our brand partner sites where you can print out temporary cards, order replacement cards, check your claims and other benefits. I did just want to note that if it's your first time accessing these links, you will be required to register so that you can create a username and password. And then going forward, you'll be automatically logged into those brand partner sites.
So some medical plan perks offered to you through IQVIA's membership. These will accompany the medical plan. New this year, we have Surgery Plus. Also, we're going to review a few items that are currently in place, including Teledoc, IQVIA Cares Pharmacist Advocate Program, and Blue Rewards powered by Rally. We're excited to announce this new supplemental benefit offered through Surgery Plus. Again, this benefit will accompany your Blue Cross Blue Shield medical plan. So with that medical plan election, this benefit is also available to you. This gives our members access to Surgery Plus's Surgeons of Excellence Network. Their network participants are licensed, board certified, they've completed a fellowship, and they have the lowest complication rates. The Surgery Plus benefit covers hundreds of medically necessary, non-emergent planned surgeries, including a few of the ones listed up here, but this is really just a small spectrum of what they actually cover. You can choose to contact Surgery Plus Care Advocate team beginning on April 1st, and if you use their full concierge team to manage your surgical needs after April 1st, the Surgery Plus team can waive your coinsurance and deductible for the surgical expenses. This does not eliminate other expenses that are associated to your surgery. For instance, if you get a knee replacement, most likely you'll need physical therapy. The physical therapy will still run through Blue Cross Blue Shield and be subject to your coinsurance structure. However, all surgery-related expenses and your surgeon, those fees will be waived, eliminating all out-of-pocket costs for that initial consultation and the surgical procedure. With this full concierge team, they will actually locate the best surgeon that meets your needs, and they'll provide you with the top 3 surgeons of excellence that they feel are best fit to provide you the surgery that you are scheduled for. So with these, they'll provide you 3 bios, a surgeon and their bio, and then that gives you the freedom to choose. These surgeons are really vetted out thoroughly, and like I said, they have the proven lower complication rates. But with this process, Surgery Plus Care Advocates will handle everything. They'll locate your physician and your surgeon. They'll schedule appointments and manage logistics. They'll coordinate between your 2 physicians, the record transfers from your current physician to your new surgeon that you're paired with. The first call is approximately 4 minutes just to get you established in their system, and the average time to procedure is approximately 35 days.
We also want to review your Teladoc benefit. It is still the $5 copay for your telemedicine or televideo consultations. You can access Teladoc 7 days a week, 24 hours a day. When you go to the IQVIA benefits portal, click on that Blue Cross and Blue Shield My Health Toolkit link, and then there'll also be a single sign-on link there at Blue Cross for you to access Teladoc. When you register, you may be asked for a company ID. For IQVIA members, that ID is IQVIA. And then the phone number is here on the screen if you need that information as well. We also wanted to highlight some of the top reasons people will consult Teladoc: sinus problems, pink eye, bronchitis, nasal congestion. We also wanted to note that Teladoc does not prescribe any controlled substances. So if you feel you may need that, you would want to contact your primary care physician. These Teladoc visits are not meant to supplement your relationship with your primary care physician. This is just an alternative to maybe urgent care or convenient care. And when you're on that Teladoc app, make sure you click so that you're sharing your records with your primary care physicians. We also wanted to just review and let you know, some of you who may not be aware of the IQVIA Cares program. With IQVIA Cares, you're given access to real pharmacists, real advocates with real solutions. They can help you do a prescription checkup. If you're not sure if you have maybe some interactions with the drugs you're currently taking, they can help you in determining whether you need a preferred brand or a non-preferred brand. If you get a communication from Optum or IQVIA Cares that relates to prior authorization, step therapy, or quantity limits, they can help you with that as well. They are available Monday through Friday from 9 a.m. to 5 p.m. and the number is here on the screen. It's also on the back of your Optum Rx prescription insurance card.
The Blue Rewards powered by Rally 2019-2020 incentive plan is not changing much from last year. All covered employees and covered spouses still have the ability to earn up to $250 in those gift card incentives per plan year. The gatekeeper remains, so the first thing that you'll want to do after April 1st is get in there and complete your Rally survey. We have upped the coin game a little bit this year, so that Rally survey is now worth 400 coins as you step through the process. And we've also added a few items that can award you additional coins, shown at the bottom. We want to highlight the Clinical Rewards program. This program targets chronic conditions. So if you have one of the conditions that's listed on the screen right here, you might be identified through some claims processing that's happened on the backside with Blue Cross Blue Shield. If you do have one of these items, your homepage when you log into Rally may look a little bit different. It will brace you with just some educational materials to help you better understand one of your chronic conditions. If you complete the reading materials or you speak with a health coach, they set forth goals for each quarter. So if you complete all of the goals that they have identified for you during the quarter, it's up to $500 or 500 coins per quarter or 2,000 coins per year. The private sweepstakes were really popular last year, so those are here to stay. There will still be sweepstakes for surveys, missions, and challenges. The most popular incentive last year was the $50 Amazon incentives that we gave out every 14 days for participation in those city challenges. So just a reminder, if you wear a tracking device, an Apple Watch or a Fitbit, one of those items, just a reminder to keep checking into those city challenges and sync your device frequently. And every time you hit a milestone, you'll be entered to win.
Next, we want to just review some of your core benefits. IQUBA has strategically paired with some of the best-in-class brand partners to offer you your benefits through IQUBA. For Blue Cross and Blue Shield is medical, OptumRx is your prescription insurance carrier, and then we have Aetna for behavioral health and EAP. And on this slide, we just wanted to make sure that you're getting the care you need at the right time and place. So we have here in green for go. Those in yellow, you may want to just consider where you want to go. And then red, of course, we have for the emergency room. So we'll review those in greens. This is your first stop for your everyday health services, your annual checkups, your preventative care screenings, your common illnesses, and your ongoing medical care and disease management. For those, you'll visit your primary care doctor. For a Blue Distinct Total Care Doctor, it's a $0 copay. And then if you're not seeing a BDTC, it's your regular 20% coinsurance. Next, here in yellow is your Teladoc Convenient Care, which is a CVS Minute Clinic or a Walgreens Healthcare Clinic, or your urgent care visits. These are for your sinus problems, pink eye, ear infections, allergies, and sore throats. Your Teladoc visits, again, are $5 copays, convenient care, $10 copays, and your urgent care is $30 copays. And then lastly, in red is your emergency room visits. These are for your life-threatening health problems, chest pains, major traumas, severe burns. The emergency room copay is $300, and that fee is waived if you're admitted. We also wanted to just note that you should be mindful of those freestanding pop-up ER clinics, which look like urgent care, but come again with that $300 copay for ER visits. So here in Central Florida, they're popping up everywhere, and I'm sure they are in North Florida. So just be on the lookout for those freestanding pop-up ER clinics. And then we also wanted to highlight that you have available to you health management and care consultants. So if you receive a call, it'll be from a trained health advisor and registered nurses. They are calling to provide you with tools and education to help you manage your chronic health conditions. They can assist you with help setting goals, help you better understand your doctor's treatment plan. They can help you with referrals, transition of care, and they can help you address gaps that you may have in your care. So IQUBA members with these specific health challenges may receive a call from Blue Cross and Blue Shield, Optum, IQUBA Cares, or an Aetna healthcare consultant. So if you do receive a call, we do encourage you to take that call so that you can get some assistance with your chronic conditions, and they may also be able to help you reduce costs as well.
So in that same member feedback, or that member survey that we also talked about, some other feedback that we got from that was the Blue Cross Blue Shield customer service line. So we shared that feedback with Blue Cross Blue Shield, and they've upped their game a little bit. So if you call the customer service number on the back of your ID card right now, it's the same phone number that was there before, but you'll be received by the Care Connected team. This is a specialized team that's trained specifically in IQUBA benefits, and they've also installed some cool technology behind that Care Connected platform. What it does is it routes your ID number to the same advocate that you spoke with last time if they're available. So if you call during normal business hours, you will hopefully be able to speak with that same advocate. This prevents you from re-explaining yourself and going through the medical items that you've already gone through with another care advocate. So if you need to reach out to Blue Cross Blue Shield, hopefully you'll get a better experience this year. Just a reminder about Blue Distinction Total Care, the free primary care visits. If you're in the market for a new doctor or physician, we encourage you to visit My Health Toolkit, and you can filter by this Blue Distinction Total Care provider. Just a reminder, all medically necessary services performed in a family practice, internal medicine, or pediatric office with this designation are always free.
Next, we just want to review the preferred PPO medical plan. There are some changes this year to the deductible and out-of-pocket maximum that we want you to be aware of. For in-network on the deductible and the out-of-pocket maximum for individual, those are increasing by $500. And then for the family on the deductible and out-of-pocket maximum, those are increasing by $1,000. Overall, those are the only major changes to the plan. Your co-insurance remains at 20%. We see here your copay structures for your office visits, outpatient therapy, your independent clinical labs, ambulances, mental health and substance abuse. All these other benefits, the copay and co-insurance structures are remaining the same. And so with those changes to the deductible and out-of-pocket maximum, we just wanted to highlight some of the services that do not apply to the deductible, and they're listed here on your screen. Your advanced imaging, your annual checkups, your lab work through Quest, your outpatient mental health and substance abuse, your speech and occupational therapy. All of these services listed here and many more are not subject to the deductible, so they won't be affected by that change we mentioned earlier. And then on the flip side of that coin, you would want to know the things that do apply to your deductible ahead of time, those major services. So your hospital expenses, maybe delivery and maternity, your home health care if you need an x-ray. All of these major services are subject to the deductible. You do have, as I mentioned earlier, that Know Before You Go tool that's available through the Blue Cross and Blue Shield My Health Toolkit. So you can search around for the best provider, the cheapest provider for those major services.
The IQUBA prescription drug plan is remaining the same for this year. So what we want to highlight on this screen is that a 90-day supply will save you money. So you can always pick up a preferred generic, for instance, at your local retail pharmacy for just a 30-day supply. But why not get a 3-month supply for the price of 2 months? So if you can, make sure to take advantage of that 90-day supply. We also want to highlight some prescription drug freebies. If you are a diabetic, prescribed diabetic supplies with obviously a prescription from your doctor, if you take that prescription to the pharmacy counter, you can receive prescribed diabetic supplies for free. Also, aspirin for adults, folic acid, and prenatal vitamins. And if you qualify, you can also receive those generic statins. So make sure that you're taking advantage of those free benefits and that 90-day supply. OptumRx upped their game when it came to customer service last year, and they got pretty good remarks on that survey. But we did want to highlight a few enhancements they made to their digital experience. You can visit Optum's portal through the single sign-on at icubabenefits.org. But through this portal, you can organize your mail order, manage your medications, view your prescription history, and you can do some really cool stuff on the website. So we encourage you to check it out.
Next, we want to discuss the behavioral health and substance abuse benefit offered through Aetna. You have access to professional counseling where you can speak with a licensed clinician to help you manage any diagnosed behavioral health conditions. We have psychiatric medication evaluation, and there's some benefits for those on the autism spectrum through the applied behavioral health therapy, analysis therapy. And we also have intensive services available for those who need hospitalization, detoxification, and residential treatment. Also available through Aetna is a condition management program called ABLE2. With these programs, it's $0 copays. It's an 8-week program with 16 sessions where you meet with a therapist and a coach. You're given a choice of that therapist and coach. You can meet with them via web-based video conferencing or over the telephone. And so they can help you with addressing the emotional challenges that come along with these health and life conditions that are listed here on the left side of the screen. I will say that I personally took advantage of the ABLE2 program for chronic pain. I cannot say enough good things about this program. I have benefited from this program tremendously. So if you have one of these health or life conditions, I encourage you to get in contact with Aetna regarding this ABLE2 program.
Aetna also provides an all-encompassing program for your total emotional well-being. So, of course, you can use the option 2 behavioral health benefits, but we also want to let you know about the employee assistance program. So it is the same number for both benefits. EAP is option 1 and behavioral health is option 2. Aetna also provides a multitude of digital resources. So if you are up for it, you can download some of these mobile apps as well. Through the Employee Assistance Program, you actually do not need to be enrolled in IQBA's benefits. You simply need to be employed at St. Mark's Episcopal Day School to access this program. So with the Employee Assistance Program, every call is always free and confidential. So you can seek emotional support, life, legal, or financial services, and you gain access to 6 sessions per issue per year. So these are any issues that arise if you need to talk to somebody about healthy eating. You can gain 6 sessions for that. Tax season's coming up, so maybe you want to get a financial consultant involved, get a little bit of advice. So anything that you want to talk about is 6 sessions per issue per year. So make sure that you're taking advantage of this benefit. The EAP is going digital. So I know that everyone is very busy, doesn't really have a lot of time to talk on the phone. So they are taking it digital, and now you can text your therapist. What this program presents is 1 week of Talkspace messaging is equal to 1 EAP session. So this gives you the ability to communicate via multimedia messaging, text, audio messages, pictures or videos through a web browser or the Talkspace mobile app. This does not give you that instant gratification that you get from text messaging back and forth with a friend. I want to caution you that the response that your therapist does have 1 working day to get back to you during their business hours. If you're using this benefit because you are one of those super busy people that doesn't have time to set up an actual meeting with a therapist, or one of those counselors, you will have to just pick up the phone only 1 time. You do need to call Resources for Living for authorization, but once that authorization is completed, you can register the app or download the app or via the web browser once you receive the authorization, and the team over at Resources for Living can help you through that process. I will let you know that this benefit is only available to adults who are 18 years and older. Your monthly medical plan premiums are on the screen here, and they are also built into our enrollment portal. And St. Mark's will continue to contribute to your health reimbursement account.
So reviewing that health reimbursement account, or HRA, we just want to give you a little detail about this plan and how it works. This plan is employer funded, and they fund this account at the end of each month. It's automatically paired with your enrollment in IQBA Benefits medical plan. So as a part of medical, that HRA comes along with it as well. This plan does offer vesting. So once you're enrolled continuously in an HRA eligible medical plan, you become vested in the funds that are in that account. So if you leave St. Mark's, you still have access to that funds via the MasterCard or the online portal where you can submit claims. Funds in the account can only be used for eligible expenses for yourself and your covered dependents under the medical plan. This is a rollover plan, so any funds that you don't use by March 31st are rolled over, and this account does earn interest that is posted quarterly. You also have access to a healthcare flexible spending account. Unlike the HRA, this account is funded by you, the employee, with pre-tax contribution. There is an annual limit on the amount that you can elect, and for this new plan year, it'll be $2,700. You do not need to be enrolled in a medical plan in order to elect the FSA. The FSA is also pre-funded, so the amount that you elect is available to you upfront on April 1st. The account is subject to the use it or lose it rule, so you need to plan wisely. Anything that you don't use that's remaining in the account will be forfeited. The account can be used for eligible healthcare expenses for you and any of your tax dependents, and it's also accessible via the IQBA Benefits MasterCard. We also just want to note that this election is active, so you must log into the open enrollment experience each year and make a positive election for the FSA.
Voluntary benefits are next, so we'll be reviewing IMED, which is your vision, Humana for dental, and Symetra for your life and disability products. IMED Vision, St. Mark's offers the buy-up plan, which is frames every 12 months and that $130 allowance. This plan is not changing since last year. It's just this is just a highlight page. So the same vision plan is being offered. And your monthly vision premiums. We also want to identify these discounts. You might not be in the market for new frames, but you can receive 20% off non-prescription sunglasses if you need some of those in sunny Florida. The dental plan, the high option PPO plan through Humana, provides 4 preventive cleanings per year. The plan year maximum is $2,000 per plan year. And the high option PPO plan also covers orthodontics, and the orthodontic lifetime maximum for each member is up to $2,000. This is also broken down in a co-insurance structure. Preventive services are free, and then basic services or major services are subject to that co-insurance after deductible. The Preventive Plus low option dental PPO plan. I will caution you that while this is an insurance plan that we offer, it is for preventive and basic services only. So members don't generally plan out a root canal, but if you should need a root canal this year, that would be a major service that is not covered by this Preventive Plus plan. So again, preventive or basic services only. This plan has a plan year maximum of $1,000, and those basic services are covered at 20% after the deductible, and this plan does not cover orthodontic benefits. and your dental plan premiums. And these premiums are also built into our enrollment portal. The income protection benefits are offered through Symetra. The basic life and basic accidental death and dismemberment benefit is provided at no cost to all active benefit eligible employees at 1 times your earnings up to $50,000. And new this year, you have the ability to elect voluntary employee life. This can be elected in increments of $10,000 to a maximum of $100,000 or up to 5 times your annual salary, whichever is less. If you go over what we call the guarantee issue amount of $150,000, you will be subject to completing some of those medical questions. Age reductions do apply. If you're over the age of 65, you will just see a slight reduction in those benefits as those reductions will show in the system as well. And then in order to purchase what we're going to talk about next, in order to purchase spouse life or child life, you must purchase voluntary coverage on yourself. So new this year, we have the voluntary employee life. Also offered on this screen is the spouse life. Spouse life can be up to 50% of the employee amount in increments of $5,000, not to exceed the $250,000. And the guarantee issue amount on the spouse life this year is $50,000. So you will only be responsible for medical questions during this initial election that are over $50,000. Child life is a flat amount, whether you're covering 1 dependent or 10 dependents. Each dependent will be covered by the same rate with that flat amount of $10,000 for each dependent. And that is never subject to evidence of insurability. If you do go above that that guarantee issue amount that we discussed in the prior slide, you will be responsible for medical, like the medical questionnaire. But I do want to highlight that since these plans are new to you, this is considered your first time elections for those voluntary plans. So only this year, only during this enrollment, if you're making those first time elections, you can go up to that guarantee issue amount that I spoke about with no medical questions if you stay below those GI amounts. If you exceed those GI amounts, you'll get a pop-up on the screen letting you know that you do need to complete the process through the Symetra Secure portal. The process will pop up after you confirm all of your benefits, and the Symetra voluntary benefits will require an active enrollment this year. So there are, it's a pretty lengthy survey at the end on your medical questions. If you are prompted to complete them, it could take you anywhere from 5 minutes to 25 minutes to complete the questions based on how you answer them. If you do not have all of the information that you need at the time, we encourage you to complete it to the best of your ability, and Symetra can contact you with any additional follow-up questions. But again, this is your one and only chance to get in there up to the GI amount for that first time election period. If you are prompted to complete an evidence of insurability following your enrollment, this is what the process looks like. On the personal information tab, you'll simply have to enter your email address and review your address, your mailing address, and then it'll take you into the health questions. So again, to the best of your ability, try to answer these health questions. Then you'll review and confirm what you entered on the prior page, and then you can submit them to Symetra for review. Any coverages that are pending insurance carrier approval must go through this process, and you must be approved by Symetra before those coverages will take effect. It is important that you complete this process at the time of the open enrollment period, because it will be the only chance that you get to complete these medical questions for those higher amounts of voluntary employee life or spouse life. Some life insurance details that you might not be familiar with. Accidental death and dismemberment. This is if something happens in the event of an accident. This policy provides additional benefits. For death in an accident, it will actually double your life insurance policy. Or if you have one of these other items, you lose both hands or feet, you lose your speech or hearing, movement and some of your extremities, loss of sight. All of these benefits come with a dollar amount associated with them. Also, if you die in a car accident, for instance, it also includes things like a benefit for a seatbelt and airbag coverage. So all of these will be outlined in the policy if you want additional information on the accidental death or dismemberment benefit. There's also accelerated death benefits. So if you're diagnosed with a terminal illness, they have really good benefits that let you get a portion of your life insurance early. Life insurance conversions are also available if you should ever leave St. Mark's. And then beneficiary companion provides support for beneficiaries who have experienced a loss.
And then lastly, we just wanted to review ACA. IQUBA's preferred PPO medical plan is equivalent to gold plans offered on the public marketplace exchanges. IQUBA has lower out-of-pocket costs, broader network of providers, pre-tax benefits. St. Mark's does contribute to an HRA, and we have more generous free wellness benefits. The 1095C tax forms are available to you now in your employee file on IQUBAbenefits.org. It's not required again for this year, but you want to make sure that you keep this for your records in case you're audited by the IRS. And then all other requirements of healthcare reform are in place here at IQUBA. We also wanted to highlight some of the mobile apps that our brand partners have available to you. And then the new Florida Blue My Health Toolkit app is available. You can access your digital medical ID cards, check your claims, find in-network providers. You can essentially do the same on all of our brand partner apps. There is that Rally app that was highlighted earlier. So these are just some of the things that are available to you as well, and we encourage you to take advantage.
We thank you very much for your attention during this presentation, and we hope you got some good information about it. If you have any questions, we are always here over at IQUBA to assist, and HR is also available for you as well. Thank you.
Thank you.